Hello everyone, I am Dr. Yamini Agarwal, a fertility consultant in Siliguri. Today I am going to discuss some common doubts which couples have when they undergo IVF. So what is IVF? IVF is also known as test tube baby treatment. In IVF, what do we do? First of all, we should understand how does natural pregnancy happen. Every month, the female's eggs matures, that is the follicle matures, every 10 to 12 days of a cycle usually, and this follicle ruptures and the eggs get released and they move inside the fallopian tube. At that time when husband and wife they have intercourse, the husband's sperms swims through the uterus inside the fallopian tube and fertilize with the eggs and form an embryo, and this embryo goes into the uterus and develops into a baby. So in IVF, whatever process is happening inside the tubes, we are doing it in the lab. So what do we do in IVF is the fertilization process that takes place in the lab. We give injections to the females from day 2 of her cycle. These injections are given for the follicle maturation, so that the target is to grow many follicles at a time so that we get as many eggs as possible in the same cycle. This follicle takes around 10 to 12 days to mature. That is, the female has to take injections for around 10 to 12 days. And once the follicle attains a mature size, that is around 17 to 18 mm, we give her an injection for the trigger and we plan an ovum pickup after 35 hours. So what do we do at the time of ovum pickup? It is done under anesthesia, and under ultrasound guidance, we aspirate the eggs from the follicles and we examine those eggs in the lab under the microscope and then fertilize those eggs with the sperms, and the embryo which is formed, we transfer those embryos either on day 3 or on day 5 inside the female's uterus, and the process is known as embryo transfer. So whatever process is happening in the tubes, we are doing it in the lab. Secondly, who are the couples who need IVF? First of all, IVF is needed for the females for whom both the tubes are blocked, maybe whatever reason it may be. Secondly, if the male has very low sperm count in which IUI or natural conception chances is very low, we go for IVF. If IUI has been done for a couple of cycles and they are not able to conceive, then we can opt for IVF. Thirdly, the common doubt which everyone has is, will the baby be congenitally abnormal if we undergo IVF? This is not so. The congenital abnormality or any abnormality in the baby is not increased if you undergo IVF. It is the same as that in natural pregnancy. So you don't have to fear that if you undergo IVF, your baby will be congenitally abnormal because of the IVF procedure. Coming to the twin pregnancy, every couple has a doubt that if we undergo IVF, we will only have twin pregnancy. It is not so. Twinning in IVF is around 20 to 25%. This is because we transfer 2 to 3 embryos in the uterus to increase the success of pregnancy. But as the technology is advancing, we are going for blastocyst transfer, that is day 5 embryo transfer, and you can even opt for single embryo transfer if the things are favorable. Coming to IVF, whether it is painful or not. Yes, surely you have to take injections for around 10 to 12 days, but as the things have been advanced so much, we get injections with very fine needles. The injections can be taken by the patient herself, provided she takes it on time. The ovum pickup procedure is also done under anesthesia, so it is not painful. You might have little abdominal discomfort for 1 or 2 days, but that is bearable. Coming to embryo transfer, that is also usually not painful and not even done under anesthesia. It is an office procedure which is very much tolerable. So the IVF process, as thought by most, is not very painful procedure. Now coming to the embryo transfer, when we transfer embryos, that is not done under anesthesia. It is not a painful procedure. And post-embryo transfer, many patients ask us whether we have to take complete bed rest. Let me tell you, there is no need for complete bed rest. If you do complete bed rest, it is not that your pregnancy rate will increase. You can do your normal activities. Just thing which you have to take care is you don't do too much of strenuous exercises. Otherwise, everything which you do normally at home, you can do. Do not lift heavy objects. Other than that, you can do all your normal activities. People coming from outside, they ask whether we can go home on the same day or we have to stay in the same place for around 14 days. It is not so. You can return back to your place either the same day or the very next day. So coming to what you can eat whatever you like. There is no restrictions as to you cannot eat spicy food or non-veg food. You can eat whatever you wish to eat. Coming to position of sleeping, you can sleep in any position in which you are comfortable. So in gist, you can do your normal activities, eat healthy, sleep properly, be happy and free. Thank you.